Uterine cancer is an oncological disease Look at this picture, shows that uterus and tumor, cancerous. CT findings, look at this. MRI and PET findings. Look at this. And detail going on. Introduction. Uterine cancer is one of the most common gynecologic cancer, mainly affecting post-menopause women. It involves the abnormal growth of cells in the uterus, particularly spreading to nearby organs if untreated. Definition. Uterine cancer is a malignancy that typically form in the lining of the uterus, known as endometrial cancer, and is most common in post-menopausal women. Early detection through symptom recognition such as abnormal bleeding greatly improves treatment outcomes and survival rates. Types. 1. Endometrial cancer. The most common type originating in endometrial lining. 2. Uterine sarcoma, rare and more aggressive, originating from the myometrium or uterine connective tissues. Types include leiomyosarcoma and endometrial stromal sarcoma. Three, carcinosarcoma, a rare mixed form that has both carcinomatous epithelial and sarcomatous connective elements. Causes. The exact cause of uterine cancer is unknown, however, it is believed to result from genetic mutations that cause cells to proliferate uncontrollably. But some non-contributing factors include 1. Hormonal imbalances, 2. Genetic mutations, 3. Lifestyle factors, 4. Family history and genetic conditions, 5. Age and reproductive factors. These factors together create an environment where the uterine lining is more susceptible to cancerous transformations. Risk factors. 1. Hormone imbalance, elevated estrogen without sufficient progesterone can lead to endometrial hyperplasia. To age, most common in women over 50. 3. Obesity, excess fat tissue increases estrogen levels. 4. Diabetes and hypertension. 5. Family history. A family history of uterine or colorectal cancer. 6. Genetic disorders. Lynch syndrome, a genetic condition, significantly increases the risk. 7. Prolonged use of tamoxifen used in breast cancer treatment. It can act as an estrogen in the uterus. Complications. 1. Metastasis. Cancer may spread to nearby organs like ovaries, fallopian tubes, or to distant organs like lungs. 2. Lymphedema, swelling due to lymph node removal. 3. Pelvic pain and organ dysfunction due to tumor growth. 4. Psychological impacts, depression, anxiety and stress. Pathophysiology. Cellular mutations in the uterine lining led to abnormal cell growth, which can invade surrounding tissues. In endometrial cancer, high estrogen levels without progesterone influence cellular changes that lead to carcinoma. In sarcoma, muscle or connective tissue changes drive tumor development. The pathophysiology of uterine cancer involves a series of steps leading to the malignant transformation and proliferation of endometrial cells. 1. Hormonal imbalance. 2. Endometrial hyperplasia. 3. Genetic mutations. 4. Cellular proliferation. 5. Inversion and angiogenesis. 6. Metastasis. In advanced stages, cancer cells may spread through lymphatic channels or the bloodstream to other parts of the body, leading to secondary tumors in organs like the lungs, liver, and lymph nodes. This progression from hormonal imbalance and hyperplasia to mutation, proliferation, and metastasis outlines the pathophysiological development of uterine cancer. Signs and symptoms. 1. Abnormal uterine bleeding. The most common symptom, especially post menopause bleeding, to pelvic pain, persistent pain in the pelvic area. 3. Unusual vaginal discharges, often watery or blood tinged. 4. Weight loss and fatigue. 5. Urinary symptoms. Pressure on the bladder or bowel may lead to urinary frequency or bowel habit changes. Diagnosis. The transvaginal ultrasound TVUS detects endometrial thickening. To endometrial biopsy, the most definitive method for diagnosing endometrial cancer. 3. Hysteroscopy allow for a visual examination and biopsy of endometrial tissue. 4. Imaging CT, MRI, PET scans help to determine the extent and spread of the cancer. Nursing diagnosis. 1. Pain related to tumor growth or surgical interventions. 2. Anxiety due to diagnosis and treatment outcomes. 3. Risk for infection post surgical intervention. 4. Body image disturbance related to potential hysterectomy. 5. Risk for fluid imbalance due to abnormal bleeding. Management. First, medical management. 1. Surgical treatment. Hysterectomy, removal of the uterus, is the primary treatment. 2. Radiation therapy for localized control and prevention of recurrence. 3. Hormone therapy, progesterone therapy may be effective in early stage endometrial cancers. 4. Chemotherapy used in case of advanced or recurrent uterine cancer. To nursing management. 1. Pre-operative care. Educate on procedure, expectations, manage anxiety, ensure informed consent. 2. Post-operative care. Monitor for bleeding, signs of infection and pain. Encourage ablation to prevent thromboembolic complications. 3. Emotional support. Provide psychological counseling and support groups. 4. Patient education. Teach about self-care, signs of recurrence and lifestyle modifications to promote recovery. Treatment. 1. Surgery, total or radical hysterectomy. 2. Radiation therapy, initial or external radiation targeting cancerous cells. 3. Chemotherapy. Drugs like paclitaxel, carboplatin. 4. Hormonal therapy. Progesterone or hormone blocking agents, especially in hormone sensitive cancers. Psychosocial medicine on body image and sexual health address concerns about femininity and sexual function after hysterectomy. 2. Emotional support. Psychological counseling for coping with diagnoses and long-term implications. 3. Social support. Group therapy can provide emotional relief and strategies for living with cancer. Prevention on lifestyle modification, maintaining a healthy weight, diet and exercise, to managing diabetes and hypertension. 3. Hormone regulation, avoiding unopposed estrogen therapy. 4. Screening, regular pelvic exams and awareness of abnormal bleeding patterns. In conclusion, uterine cancer is a significant health concern with a high survival rate when diagnosed early. Preventive measures, early detection and advancements in treatment options often hope for women at risk. Continuous advancements in targeted therapies and better understanding of the disease processes are promising for patient care and recovery. Thank you. Have a nice day.